Welcome back to Central Valley Talk. You know, we reserved this period, this segment, to talk about issues that seniors face mostly. And our last guest made me realize I'm a senior too, or I'm about to be, or something. And I'm trying to figure all this out. When do I take Social Security? When do I get Medicare? What's Medicaid? There's so many questions I have. And usually I just jump in my car and drive down someplace, but you can't right now because of COVID. So I've asked an expert in this area, Cluff, to come on the show. Welcome, Paris, by the way. And I want to ask you some stuff. I got to figure all this Medicare supplements, all this stuff out. So, by the way, what's the name of your company?
So I'm an independent insurance agent in the state of California. So it's Cluff Insurance.
That's easy to remember.
Yep. I have a Facebook page, so you can just type in Cluff Insurance on Facebook, and you'll find me there too.
There's not a lot of Cluffs out there anyway. They're going to find you.
Good point.
Now, I understand when I hit 65, we all go on Medicare. And that's some government-paid health insurance.
Yep.
And during a certain time of year, I only know this because we've been doing this show for a couple of years, and at this time of year, people show up who are experts like you and say, hey, it's open enrollment for your supplement. Am I right? Am I following the...
So open enrollment is for Medicare Part C, which is in Medicare Advantage, and or Part D, which is for prescription drugs. And so open enrollment runs from October 15th to December 7th every year. And in that period of time, seniors can choose a new plan Part C or a plan Part D. Supplements are a little different, and they're actually, a lot of people don't know this, but supplements you can enroll any time throughout the year in a supplement. But it's the prescription plan and the Medicare Advantage plan that have the specific time frame that you need to worry about.
Now, I've known a couple of people who said, I don't want that. I don't want to have that extra cost. And next thing you know, they have this prescription that's $500 a month or something, and just wipes them out.
Yeah.
Now, so not only should you get it, and most people watching probably already have it, but you're saying right now is a period where you could kind of review and maybe switch plans a little bit. Absolutely.
So somebody who wants to enroll, each one of the Medicare Advantage plans or prescription drug plans usually go for a 12-month period. So it's from January to December 31st. And so next year, 2021, is what we're doing now. We're enrolling people for next year, 2021, for Medicare Advantage or Medicare prescription drug plans.
Okay. Now, I've looked through these things, and it just makes my head spin. I'm thinking, couldn't we just go to an expert like you and say, hey, I need this, you could kind of point us in the right direction?
Absolutely. Local agents would love to have you talk to them. So we there's every year there's commercials. You can call an 800 number and you can get a service over the phone. But the local agents like me would love to be able to service and work with you and help you and make sure that you're making the right decisions for your insurance needs.
Hey, what do you charge for one of these consultations?
So we don't, as agents, I don't charge anything, and most agents don't charge anything for the consultation. We get paid traditionally as a commission, so we get paid once you enroll in a plan. So if you enroll with us as your agent, then the insurance carrier will then pay us a commission for that enrollment.
Well, what I'm thinking is if you've had Medicare for a couple of years and you've had this Part C and D plan, I think you said, why not just go and ask someone like you? It's free to ask, right?
Exactly.
And just say, hey, can you look at this and make sure I'm getting my needs met? And they should do it, right?
Yeah, I do a lot of reviews every year with my current clients, and that's one of the things that they really like. And I don't have a lot of my clients really enjoy meeting with me every year and sitting down, and we just review and make sure that they're on the right plan. Every year we just make sure to moving forward.
Very good. Now tell me about this. We're talking a little before, if you have Medicare and Medi-Cal, that's for us here in California, there's something special or something different anyway.
No, you're right. So there's for people with Medicare and Medi-Cal, they're called dual special needs plans. And so if you qualify for Medi-Cal in the state of California, that's what we call Medicaid. And so if you have the card that you see in front of you there, then that means you qualify for Medi-Cal. There's different levels of coverage, so depending on the level of coverage you have, there's different plans that are specific for you. And so if you've got the Medi-Cal card and the Medicare card, there's a lot of extra benefits that you could be eligible for if you want to, like dental benefits, vision benefits. There's even some really neat benefits where you can get like a catalog of goods that you could buy at a local pharmacy, but you get a catalog where you can kind of do a shopping spree and get a chance to buy a bunch of things like that are offered from the company for zero to you, zero cost to the.
And how do you qualify for that?
So if you have Medicare and Medi-Cal, then you basically qualify to sit down and see and have a review and you can get, based on the doctor and the different prescriptions you're taking, we'll go through and assess the right plan for you. Right now, United Healthcare, Medicare Solutions has a dual special needs plan that they're really trying to promote and get some traction in Fresno. And it's a really great plan. They're really doing a lot of great things. But there's other companies that have them as well. So it's just a matter of sitting down, making sure that the doctors that take it, the prescriptions are on there and they're covered, so that we don't, so we have everything that you need covered for what you're looking for.
I guess what I was asking, how do you qualify for that? The Medi-Cal, I guess if you are qualified for Medi-Cal, you have it, and you have that card, so you know you're qualified. So.
Pardon me, yeah. For Medi-Cal, you have to have low income, so you'd work with a social worker or somebody in the county level that would help you. I think there's you can contact somebody to see if you qualify for Medi-Cal. You can actually call Medicare and have them run that for you, and you can even do something called low income subsidy. The low income subsidy is actually an option for people who don't qualify for Medi-Cal, but they still have low income, and they'd still like to have some extra help for their prescriptions and other things, so they can get involved in the low income subsidy.
Very good. I don't know, can we run through those slides again? Yes, this one first, and then we're going to stop on the third slide. This is which one now, Paris?
That's the Medi-Cal card.
So if
that's for the state of California. So if you've got that card, you qualify for the low income under the state of California for Medicaid.
And go to the next one. And that's Medicare, which all us old people are going to have if you're 65. And then this one, go to the third one there and tell us about that.
The other thing, too, just really quickly on that other card, is if you have a disability for more than 24 months, you would qualify for Medicare as well.
Okay.
You'd have to go through...
Not just old people.
Yeah, not just old people. So if you have a disability or disabled for more than 24 months, you can have that. The other card, that last one was United Healthcare's. If you've got the Medi-Cal card and you've got the Medicare card, then you can get extra
Go to this
benefits.
one. Go to that, no, the third one. There you go, that one.
So, yeah, that one is if you've got the Medi-Cal card and you've got the Medicare card, then you can get extra benefits. And there really are some really neat extra benefits that you can have.
So if somebody's out there and they have those two cards, they had to call you.
Yeah.
Is this open enrollment also, kind of?
So open enrollment for people who are Medicare and Medi-Cal is December 7th as well. However, throughout the rest of the year, they have special enrollment periods that they can take advantage of, and it's per quarter. So January through March, and then April through June, and then July through August, and then then in October they have to follow the special enrollment, open enrollment period.
And I'm not going to remember all this. Call Travis Cluff and ask him about that. If you have those two cards, they should call you.
Yeah, absolutely.
Free again. It's free to call. Did I say Travis? Paris. It's free to call Paris Cluff anytime, right?
Yep.
And it's through United Healthcare.
Yep.
And are you allowed to say anything else about that program? Or?
I'm an independent insurance agent, so I offer insurance products from all the major Medicare Advantage plans and Medicare supplements that have a plan in Fresno. But United Healthcare has they have a really good plan for people who have Medicare and Medi-Cal and need to have some extra benefits and additional things that they want to do with their health care.
Okay. And I'm a pretty bright guy, and the whole thing has me a little confused. And I'm sure our viewers are saying, yeah, I'm just not sure what to do, but Paris Cluff will help you through it.
Absolutely.
How should they reach you?
So they can call me at 559-825-1678, or they can go to my Facebook page, which again is Facebook and then Paris Cluff Insurance. And that's pretty simple and easy. And I'll respond. If I don't answer, then please leave a message. It's very busy right now this time of year, so
I bet.
I will get back to you, I promise, and we'll get what you need.
Tell you what I'm going to do. A lot of our viewers are, maybe you're driving in your car or you don't have a pencil, whatever. I'm going to have Paris's information. I'm going to keep it on my desk. So if you can't reach him or don't know how to reach him or don't know how to go to Facebook and type Paris Cluff, call me here at Central Valley Talk. I'll give you a Paris direct number if that's okay.
Sure.
Paris Cluff, the guy to go to for these kinds of insurance. He's an expert, by the way, and he can help you sort through some of this stuff. So,
thank you.
Any last thoughts for our viewers?
No, I've been doing it for 10 years, and I love working with seniors. I love helping people understand what to do and how to navigate their insurance needs, and I'd love to help you.
I could really tell you know what you're doing. And I endorse him. I say call Paris Cluff. We'll be back with more Central Valley Talk right after this.